March is Intellectual Disability Awareness Month, and Cape Mental Health is raising awareness around the equal rights of persons with intellectual disabilities to education, lifelong learning, and employment in the open labour market. Statistics based on the 2010 household survey show that there are approximately 467,000 children with disabilities who are out of school, and that only 4 to 5% of young children with disabilities are accessing early learning facilities. In an already overloaded and under-resourced education system in South Africa, children with intellectual disabilities are becoming increasingly more marginalized. Equally, adults with intellectual disabilities have very few and very limited opportunities when they exit the school system.
Adults with intellectual disability face many barriers when it comes to accessing post-school education. They do not leave the special school system with a qualification that will enable them access into further education and training opportunities. For example, let's take Busi. Busi leaves a special school. She would like to do a caring course at a basic level in a further education and training college. Busi does not have the qualification that will firstly gain her access. Secondly, that qualification will have two stumbling blocks. It will be numeracy and literacy. Many adults, like Busi, with intellectual disability, will not be able to qualify without numeracy and literacy, the components to that course. Adults with intellectual disability, not all of them are able to engage that kind of curriculum successfully. This will be a huge barrier to them to gaining that full qualification. Even though Busi would have ample ability and practical skills to be able to engage the rest of the course. Cape Mental Health are in the process of developing a post-school qualification for adults with intellectual disability. This qualification is aimed at bridging adults with intellectual disability who leave the Elson school system and would like to enter further education and training, or alternatively find employment in the open labour market. We are facing a number of barriers in developing this qualification. For example, funding. Enormous amounts of money is needed to develop such a qualification and also to train and employ trainers that will be able to render the programs. We also face a challenge of finding employers in the open labour market that will be willing to partner with us so that we can place learners in their contexts and their work environments so they can learn more about what it is to be a worker in those environments. So these are just some of the barriers that Cape Mental Health are busy facing at the moment as we start developing a post-school qualification for adults with intellectual disability so that they can have the right to access employment and learning.
Good day, my name is Gwendolyn Daniels. I have intellectual disability and I feel that it is important that people with intellectual disabilities has the right to education and employment, so that we can improve our lives and be part of things that other people can do. Cape Mental Health has helped me achieve these things. I started at Training Workshop Unlimited in 2000 and at that workshop as a trainee. I was then elected as a team leader, where I was given the role of orientating other trainees into contracts. I was selected to be part of the Cianida project, where I was involved in care for the aged. Part of my practical placement was working with seniors with dementia. The experience taught me the patience and how to care for people that cannot care for themselves. I was employed in the life skills area at TWU in 2005 as assistant instructor. Working for the company for 10 years is a big achievement for me. In the life skills area, I do the orientation in the morning, I do the exercise with the trainees, and I conduct the leisure time activities for the day. And I also do administrative work where I assist the life skills instructor with her lessons. TWU has given me the opportunity to represent people with intellectual disabilities on a national level. I am involved in the South African Federation for Mental Health and the South African Mental Health Advocacy Movement, SAMAM. Currently, I am also on the board of representatives for Cape Mental Health and TWU in the Western Cape Network on Disabilities. Through this, I am given the opportunity to show others it is really all about ability. I have also been given the opportunity to travel through Cape Mental Health, and I have even traveled on my own to Johannesburg, where I represented Cape Mental Health and people with intellectual disability. Cape Mental Health has encouraged me and equipped me with the skills to be more independent, more motivated, and more confident.